Hi, my name is Taylor Alicious and I am a nursing student. I am going to present a patient to you right now. Patient is a 52-year-old married Caucasian female. Her former job was as a head sales manager at a global pharmaceutical corporation. Patient came in with a chief complaint of possible cardiac arrhythmia as well as severe tonsillitis. On February 25, 2017, the patient visited a local cardiologist in Newport Beach, California for evaluation of the possible arrhythmia. The physician put her on a 24-hour Holter monitor to measure and record her heart activity and track any abnormalities in her heartbeat within that time frame. However, there were no abnormal findings. 3 weeks prior to visiting her cardiologist, she sought care from her primary care physician as she felt her heart was beating really fast and not slowing down. She also felt that she could not catch her breath while performing everyday activities such as walking up the stairs. At this time, she does not have any pain related to the possible cardiac arrhythmia. However, she does have pain due to the severe tonsillitis. She rates this pain as a 5 out of 10 in intensity. She has had acute tonsillitis 6 times in the past year. Tonsillitis onset was 3 days ago. Pain is located in her tonsils, posterior pharyngeal wall, and neck. She also states that the pain in her neck makes it difficult and sometimes painful to swallow. The pain is constant and is alleviated with ibuprofen. Patient describes the pain as achy and dull inside of her mouth and around her neck. She has used azithromycin the past 6 cases to treat the tonsillitis. She feels that she may need to have a tonsillectomy. Her tonsillar lymph nodes are very tender and swollen. Her case of tonsillitis does not get in the way of performing daily activities. She mentioned that the pain caused by tonsillitis is alleviated with ibuprofen, however, is worse in the mornings and at night. Pharmacological and non-pharmacological interventions include pain pills and rest. Her vital signs are stable. Her blood pressure is 136/88. Heart rate is 58. Respirations is 16. Temperature is 37.7 degrees Celsius taken orally, and her oxygen saturation is 98%. Past medical history: varicella, parotitis, influenza, depression, and anxiety. All immunizations are up to date. Drug allergies. Patient had a reaction to Versed when used for procedures. She was told that she had difficulty breathing properly when sedated on this medication. Past surgical and hospitalization history. Patient was hospitalized 20 years ago for severe vertebral disc herniation of the L4-L5 discs. Patient was also hospitalized for 2 cesarean sections performed in 1998 and 2000. Current medications: Lexapro for anxiety, menopause symptoms, Zyrtec as needed for seasonal allergies, ibuprofen as needed for headaches and joint pain. Functional assessment: patient denies tobacco and illicit drug use. She drinks 1 glass of wine daily. Patient's caffeine use includes 2 cups of coffee per day and 1 to 2 Diet Cokes per day. Patient states she sleeps well and denies any sleep disorders. Patient also denies any change in appetite. Psychosocial: patient currently lives with her husband in their home in Newport Beach, California. Patient's 2 brothers and 1 sister and 2 children are all living. Patient denies any self-esteem or body image issues. Coping mechanisms include exercise, running her own design business, and social media. Patient denies any other outside stressors. She and her family identify themselves as Jewish. Family history: mother suffered from colon cancer, chronic asthma, and COPD. In addition to environmental allergies, she died of a heart attack at age 56. Her father had a history of hypertension, Parkinson's disease, high cholesterol, basal cell skin cancer, aortic aneurysm repair, transient ischemic attacks, and heart disease. He died at age 83. Her first brother has hypertension, suffered a heart attack at age 57, and has been a long-term smoker. Her second brother has a cardiac arrhythmia and hypertension. Her sister has thyroid disease, a heart arrhythmia, endometriosis, chronic sinusitis, and bladder cancer. No other family members with autoimmune diseases. Review of systems: number 1, cardiovascular. Given the patient's possible cardiac arrhythmia, it is important to perform a cardiovascular assessment. Patient has a family history of cardiovascular disease and myocardial infarctions. Patient states that she feels that her heart is beating very fast. She also said sometimes cannot catch her breath. Patient says she feels like this 1 to 2 times per day, and it has been going on for a couple weeks and that it has been getting worse. Patient also says she feels more tired than usual and does not have had enough energy to participate in daily activities such as going to the gym. She has felt the need to take a nap each day, which is abnormal for her. Patient also states that dizziness gets worse if she stands up too fast. Patient denies chest pain and arm or jaw numbness. Patient does not have any noticeable heaves or lifts. Contour of the chest is symmetric. No lifts or throws palpated over the aortic, pulmonic, Erb's point tricuspid, or mitral areas, or over the point of maximal impulse. Patient was auscultated sitting up and laying down using the diaphragm of the stethoscope over the 5 key areas. Patient does not have trouble laying down. Bradycardia noted due to heart rate of 58 beats per minute. Patient was also auscultated sitting up and laying down using the bell of the stethoscope over the 5 key areas. Murmur was noted, best heard over the mitral area. No S3 or S4 sounds noted. No palpitations. Review of systems number 2. Head, ears, eyes, nose, and throat. Patient's tonsillitis is another priority for her, therefore it is necessary to perform an assessment of the head, ears, eyes, nose, and throat. Patient denies frequent or severe headaches, head injury, and vertigo. Skull is round and symmetric. No tenderness with palpation of the head. No deformities or lumps noted. Facial expressions are appropriate and facial features are symmetric. No involuntary movements, edema, lesions, or changes in pigmentation. Patient presents with full range of motion in the neck. Trachea is in midline. Inflammation of the thyroid gland is also noted. Enlargement and tenderness noted with palpation of the tonsillar, submandibular, and deep cervical lymph nodes. Patient states it is painful to move her neck. Patient denies eye pain, diplopia, glaucoma, and cataracts. Skin of eyelids is intact with no redness, swelling, discharge, or lesions. Eyelashes are evenly distributed. Conjunctiva is moist and clear. Cornea is clear. Irises are round and the same color. No tenderness of the lacrimal apparatus. Visual acuity of 20/20 with glasses. No peripheral field loss. Corneal reflex intact. No nystagmus present. Pupils are equal, round, reactive to light, and accommodation reflexes intact. Patient denies earaches, ear infections, and tinnitus. Ears are symmetric. No swelling, redness, or discharge present in the ears. Rini test of 2:1. No excessive swaying with Romberg test. Patient denies severe colds, sinus pain, nosebleeds, and change in smell. Patient states that she has severe seasonal allergies. Nose is symmetric and proportional to other facial features. No inflammation, deformities, or lesions noted. Equal bilateral patency. No discharge, bleeding, or foreign bodies noted. Septum is in midline and intact. No pain with palpation of frontal and maxillary sinuses. Patient denies bleeding gums, toothaches, altered taste, and change in voice. Postnasal drip, lesions, and inflammation present on posterior pharyngeal wall. Calcifications and inflammation present bilaterally on tonsils. Hypoglossal, glossopharyngeal, and vagus nerves all intact. Patient states that she has a sore throat, dysphagia, more blisters, and calcifications than usual. Pertinent system number 1, respiratory. Due to the fact that the patient has presented with bradycardia as well as a heart murmur, it would be important to also perform a respiratory assessment. According to an article from the Brazilian Journal of Medical and Biological Research, a study examined the relationship between heart rate, variability, and pulmonary function. In this study, they found that pulmonary function presented positive bivariate correlations with the parasympathetic and overall HRV indices. It was also stated that the association between pulmonary function and HRV was also independent of smoking, physical inactivity, and cardiovascular risk factors. Furthermore, they found that this correlation between HRV indices and pulmonary function was positive, meaning if the HRV index increases, pulmonary function would also increase. Pertinent system number 2, peripheral vascular. Due to the patient's family history of cardiovascular disease, hypertension, and high cholesterol, she would be at risk for peripheral vascular disease. A study funded by the University of Washington Department of Surgery Research Reinvestment Fund was done to assess the risks of peripheral vascular disease. In this study, they found that 57% of the respondents' most frequently reported risk factor was hypertension, followed by cardiovascular disease. The study also found that the age group with the highest risk of PVD is between ages 50 and 59, which also puts the patient at risk. Therefore, it would be important to also assess her peripheral vascular system.